South Africa is dealing with issues around procuring enough vaccines, logistical hurdles, and communication challenges in overcoming vaccine hesitancy. My next guest aims to increase the rate at which the most vulnerable in peri-urban areas are vaccinated against COVID-19. We're joined now by Clinique's Chief Operations Officer, Dr. Ernest Ginoshi. Good evening to you, and thank you so much for your time. Firstly, we've been hearing different conversations when it comes to accessing the vaccine, and certainly the fact that we've had predominantly the Pfizer vaccine in the country, we're told that that has been part of the reason why we have urban areas having higher rates of vaccinations than rural areas.
Good evening, Kathy, and good evening to all the viewers of Newzroom Afrika. Yes, indeed, I think the country has been using Pfizer for various reasons lately, and the plan is that Pfizer that was the original plan, that the Pfizer vaccines will be used mainly in the urban areas, simply because of their needs, their cold chain needs, and that Johnson & Johnson van will be used mainly in the rural areas. I think that plan must have been changed a little bit now, so it will all be about availability. But Clinics has been vaccinating for the past month in the 6 vaccine sites that we have in our hospitals, and we've been using Pfizer, Kathy.
What have been the challenges that you have experienced when it comes to administering these vaccines, especially for populations in rural areas?
Yes, well, Clinics, hospitals are mainly in our townships in Gauteng. We've got 7 sites at the moment, and 5 of the 7 hospitals, we've got 6 sites active for the last month. The 5 of them are in Gauteng, in the Vaal, 1 in the Vaal, 1 in Ekurhuleni at Vosloorus. There are 2 in Soweto, and there's 1 in the city center in Johannesburg. The 6th one is in Mafikeng, in Victoria Hospital, and those are the hospitals of Clinics Health Group that have activated sites, vaccination sites. I think that the biggest challenge, Kathy, has been the fact that the hospitals are situated by choice in the townships. Now, most of the over 60s in the townships are uninsured. In other words, they don't have medical aid. And as you know, it is government's decision, policy that they would vaccinate, we should vaccinate the over 60s. Those who are covered by medical aid should go to private hospitals and other private sites, the pharmacies and so on. But those who are not insured, don't have medical aid, should go to government institutions. So we found that a lot of the vaccinees, potential vaccinees who come to clinic sites are not insured, and that has posed a problem because we want to vaccinate them. By the way, we want to vaccinate everyone. We are in contact with government as it is now to allow us to vaccinate everyone, whether you are on medical aid or not, in our sites, because we want to vaccinate as many as possible of our people.
When it comes to matters of vaccine hesitancy, what have you been able to pick up from South Africans? You know, where do we stand? Do you find that you have a lot of people that are keen to get vaccinated? And for those who are on the fence or who don't want to get vaccinated, how are you able to change their minds?
Yeah, unfortunately, yes, there is a vaccine hesitancy, Kathy. It was more so than it is now. I think the country is winning in the battle of convincing everyone to vaccinate. And I think the fact that some of the prominent people have vaccinated and showed and done so publicly, but also the evidence that has come out from internationally and in medical journals that people who are vaccinated are more likely to have, if they do get the disease, they'll get milder disease. They don't land them in hospital, don't land them in the ICUs and so on. So we are having more and more people interested in getting vaccinated. And I think most people are waiting for their turn as soon as government allows the over 50s and the over 40s to vaccinate, and all those with comorbidities below 60. I think we will see in bigger numbers. Most of those that could come at above 60 have presented themselves, except for the fact that that I've mentioned, that if we allow more uninsured people to go to any site, that they should be scheduled for any site, whether it's private or government, we will make sure that people go to the nearest facilities, and it will increase the number of people who show up at vaccinations.
One of the things we've been told, Dr. Ginoshe, before I let you go, is just the extent to which hospitals in Gauteng are reaching for capacity. We're sitting at 80% capacity that has already been taken up now. Speak to me from the perspective of your healthcare facilities. What has been your experience when it comes to these increasing numbers of COVID-19 cases?
Yes, we've seen a huge increase in the last 2 to 3 weeks. And almost in all the areas simultaneously, including both around Gauteng and Northwest, where our hospitals are currently situated. And unfortunately, most of the people who come already very sick. They wait, because it is a policy of our country that you don't have to get hospitalized when you test positive. So people tend to stay at home being positive and come only when they cannot stay at home anymore because of the severity of the illness. So by the time they present themselves, they need ICU. So our ICUs are running at 100% capacity at the moment, which is a challenge. We are managing, but the designated COVID-19 wards are between 75 and 80%. So we still have capacity in our hospitals to cater for more patients, but our ICUs are suffering, especially when it comes to staffing. We have enough specialists, the physicians are there. Nursing staffing is a problem because we have to share it with the public sector, the other hospital private groups as well. So our specialized nurses in our ICUs are overstretched, and I think that's where the strain is most felt, Kathy.
Dr. Ernest Ginoshe from Clinics, thank you so much for your time tonight.